Most of us dread visiting a dentist. More often when he looks into your mouth and says, "I'm seeing a cavity here." Sometimes we wonder, what am I doing wrong? I think I'm doing everything right. I brush twice daily. Yet my gums bleed and I have bad breath, which makes me terrified while getting close to talking to people. And I also get a filling, a new one that too, every 6 months. The answer is you're using the wrong armor in fighting a war. In this video, I shall share a 4-step formula which will completely transform your oral health. So if you want to stop expensive dental treatments and enjoy going to a dentist for regular cleaning, then this video is just for you. First, let us understand the enemy. It's not just the sugars in the food you consume. It's a tiny microscopic city of bacteria that thrive in your mouth. Did you know that there are around 700 varieties of bacteria that live in your mouth? These bacteria eat when you eat and release acids as byproducts. These acids eat away your enamel and lead to cavities and infection of your gums in the long run. But here's the revelation. After every meal, within 20 minutes to a few hours, a soft, sticky, whitish yellow coating develops on the surface of your teeth, which is known as dental plaque. If dental plaque is not removed consistently and constantly after it is formed, within 24 to 72 hours, it hardens into a product called as tartar. And this tartar cannot be removed by normal toothbrushing, but you have to visit a dentist to get it professionally scaled. Another important point is bleeding gums. Sometimes bleeding gums is caused because of aggressive toothbrushing as well as using a hard bristled toothbrush. However, in most of the cases, bleeding gums is because of infection of your gums. It also says that your gums are crying for help. Now, coming to the 4-step forever formula. Step number 1, the 30-minute rule. After any meal, especially if you have had acidic food like citrus fruits or sugary food, you have coffee, tea, soda, lime or wine, the acid in these foods make the enamel soft and porous temporarily. So if you brush your teeth immediately after a meal, the brushing will scrub away the enamel, leading to sensitivity and cavities in the long run. So it is recommended to avoid brushing your teeth for at least 30 minutes to 60 minutes after you have had a meal. Step 2, the 2-2 rule of dentistry. It means you need to brush your teeth twice daily for 2 minutes each time, and you need to visit your dentist 2 times in a year. So use a soft bristled toothbrush with the bristles at an angle of 45 degrees to the gum line. Do not scrub your teeth with horizontal strokes. Use gentle pressure, up and down, to and fro motion, and circular motion is also recommended. Clean the outer, inner and the chewing surface of your teeth thoroughly. This should happen for 2 minutes every time you brush your teeth. Again, another important point to be noted is the bristles. You have to opt for soft bristled toothbrushes. Never go for hard bristled toothbrushes, and buy a medium bristled toothbrush only if your dentist recommends it. Step 3, the silent killer technique. So with toothbrushing, you clean only 60% of the food that is stuck on the surface of the tooth. The remaining 40% remain hidden in the small gaps between the surfaces of the teeth and near the gum line, sometimes even below the gum line. So to clean this 40%, flossing is very essential. It is important to floss your teeth twice in a day, more importantly in the morning before you brush your teeth. This is the ideal time for flossing your teeth. If you want to know how to floss your teeth, it is given in the link below. The step 4, which is a no rinse policy. So you have to use a fluoride toothpaste while brushing. It is not necessary to go for premium, expensive brands of toothpaste. However, you have to check if the toothpaste contains fluoride as the chief ingredient. So after brushing, do not rinse with water. You can spit. However, the toothpaste should remain on the surface of the tooth for the fluoride to act and not go down the drain. So now coming to bad breath. The chief reason why you get bad breath, even if you are brushing twice in a day, is because you are not focusing in the right areas. 80 to 90% of the bad breath causing bacteria live at the back of your tongue. So you need to buy a tongue scraper. It works better than a mouthwash. Taking care of your teeth does not just mean avoiding expensive dental treatments. It also means taking care of your overall health, because diabetes and certain heart diseases are linked to severe gum disease. So you don't need a miracle, you just need to be consistent. Grab the tongue scraper, do not rinse after toothbrushing, and floss regularly. If these tips are helpful, please click on the like button and subscribe to my channel.